Well, great. Well, we are going to go ahead and jump right in and get started. Thank you again for joining us this Thursday, April 22nd. Can't believe that we're almost done with April and really looking towards the summer. So those of you who have people in school and I'm sure you're thinking, summer, it's right here. It feels like yesterday we were celebrating the holidays, but we're gearing up for summer. So we want to continue to put great resources in your hands. My name is Sierra Bragan. I'm the owner and founder of Miami Mom Collective, Miami's premier parenting resource and community. Our goal is to put awesome resources in the hands of moms and families to create events for you. And so one such event is this right here, right now, with our amazing partners at UHealth Jackson Children's Care. We're so grateful and thankful for them, for the consistency of these webinars. It's been a year now that we've been bringing these resources to you virtually. We will not let COVID stop us from bringing you great resources. So want to take a minute to tell you a little bit more about UHealth Jackson Children's Care. Their pediatric emergency rooms at the Holtz Children's Hospital, as well as Jackson North, are available to you 24/7. And Holtz actually has a 24-hour kids only emergency room. So I say it every time. I hope you never need an emergency room, but if you do, please make note that Holtz as well as Jackson North are available to you. And they're all staffed with board certified pediatric emergency medicine specialists. So you're getting the best care from every pediatric subspecialist, not only from the Holtz Children's Hospital and the University of Miami Health System, but also the Jackson Health System. So all of the doctors and nurses are also certified in pediatric advanced life support. So I know these aren't things I think about when I'm running to the ER because I'm just running to the ER, but good things to know. Make that mental note in your mind. If you ever need an ER, you're going to get just the best care there. So the Holtz Children's Hospital as well as Jackson North. So tonight we're talking about a very important topic. And I will say, as a mom, I know this topic is important as an adult, as a mom, as a woman. Honestly, prior to COVID, I think I never really thought about it in children. I think COVID has made all of us think about all the things. And so just the effects of this last year even has made this topic even more relevant than it already is on standalone terms. So we're excited to have with us tonight Dr. Allison Weinstein. She is the Assistant Professor of Clinical Pediatrics, as well as a licensed psychologist with over 10 years of experience working with children and families. So she specializes specifically in helping families manage their child behavior concerns while strengthening their relationships, which the two really go hand in hand. We don't want to just manage children's behavior, right? We don't want to modify their behavior, but we want to strengthen relationships as well. So Dr. Weinstein co-directs the Mailman Centers for Pediatric Psychology Clinic, and she also is the director of training for the Parent-Child Interaction Therapy Program. And if she has any free time, I don't know how she does, but she leads the University of Miami's Parent Club program, providing evidence-based services to Miami-Dade County families. So without further ado, please join me in giving a virtual round of applause. Welcome to Dr. Allison Weinstein. Welcome, Dr. Weinstein.
Thank you, Sierra. I'm really happy to be here with you tonight to talk about depression.
Oh, we are really excited. Yes, it's a topic that I kind of just want to take a breath, before we even get started, because it can be a tough topic and it can be such a taboo topic that we don't talk about. So I'm excited tonight in this space, we can really have an open dialogue. And I want to draw your attention, those of you who are watching, if you look at the bottom of your screen, you'll see a chat box and you'll see a Q&A box. If at any moment you have a question, you can drop that in the Q&A box. We will do our very best to get to all the questions. Sometimes we get lots of questions, so we'll do our best. But if you have a specific question for Dr. Weinstein, you can drop that there. But let's get started. Let's dive in. Big, broad question to get us going. What is depression?
Okay. So that's a big, broad question to get us started, but I think to set the kind of context for all the other things that we'll talk about. And so I think it's most important to note that depression is a type of a mood disorder, but it goes beyond the ordinary ups and downs that you might see that are normal. So it's more than just the occasional or mild sadness. It's really a serious medical condition. It affects the way that people feel, but also the way that they think and act. Of course, it causes you to feel sad, but it also, for children and adults, gets in the way of functioning. So things like missed school, friendships that suffer, or family problems can be symptoms of depression or part of a syndrome of depression. You can get symptoms that are mild all the way to severe. And just to give it some context, that about 1 in 6 people will experience depression in their lifetime.
1 in 6. Wow. Okay. That's interesting statistic. Wow. Talk to us about what causes depression. Is there like a certain, 1 or 2 handful of things? Like what would we say causes depression?
Yeah, so that's a really important and I think a complex question. And really we can categorize what causes depression into a few areas. So there's biological causes, there's genetic causes, and there's psychosocial causes. We can think of biological causes as maybe chemical imbalances in the brain or in the body. Genetic causes, so depression is at least partially genetic. It runs in families. So if, there's about a 10 to 25% risk of depression for a child if their parent has depression, and the more relatives that have depression, the higher the risk goes up. Then there are psychosocial causes as well. So social and cultural kinds of things, bullying, stress, trauma, social kinds of problems or being excluded, those kinds of things can play into it as well.
That's good. I love that you broke it up in those categories, because I think that helps kind of wrap not only our minds around what could cause, but that's a great kind of, diagnostic place to start in terms of, like I said, it's a taboo topic we don't talk a lot about. And some of us may not even know that our family has a history of this because of lack of talking about it, but that's a good thing to know, those biological and genetic, and then also the psychosocial. That's great. What about, let's talk about in children. Does it look different in children? And do they, do the signs differ between little kids and teens?
Yeah, that's a great question, because indeed they do differ between the older kids. So adolescent depression, so teenagers, it doesn't differ a lot from adult depression. The symptoms are generally around mood, physical symptoms, functioning. So I would say those 3 areas. If you have a teen with depression, they might seem sad. They might even seem irritable. I think that's one of the big takeaways from what we're going to talk about tonight, is that in children, teens and young children, you might see more irritability than sadness. So you wouldn't necessarily think of depression or even aggression. These kinds of things, mood and behavior, can signal that there's a depression problem there. If the hopeless or helpless, they're saying things like, I'm no good, I'm a loser, this kind of thing, they might feel worthless, those kinds of feelings, or even feelings of guilt. They might have thoughts of self-harm or suicide or death. And then physical symptoms can include changes in very basic things like appetite, changes in sleep, so sleeping too much or too little, eating a ton more, eating a ton less. It would have to be more than just your normal fluctuations.
Okay.
You might see energy low. Maybe they're more tired compared to how you're used to seeing them. Right. And they might have something we call psychomotor slowness, which just means that they're moving a little bit more slowly. Can be a symptom of depression. Functioning is also affected. That's a very important piece to remember, that they're going to show a difference in the way that they function day to day. So losing interest in activities that they once enjoyed, trouble making decisions, things like that. So that would be more around the teenagers. Okay. And then for younger kids, you might see depression is making them more irritable than sad. So they're getting upset more, they're getting angry more, they're less interested in their toys. They don't want to, less interested in playing with their friends. For younger kids too, that the depression episodes tend to be a little bit shorter. So instead of, days and days in their room, you might see it flash a little bit quicker. Okay. Younger kids tend to be more reactive to the environment, so changes in routine. You see irritability, tummy aches, headaches. That's a big one with the little kids. So something we call somatic symptoms is going to be different. So if your kid is always, I have a tummy ache, I have a headache, that's something to think about. Is that playing a part? Might there be some depression there? Yeah.
Wow. Talk to me about when you talk about young children. I have young children. So of course I'm more like, want to know all about the young children. I know there's probably parents out there who have teens as well. We'll get more into all the topics, but talk to me about little people, like how little, like how young are you saying that we could see these symptoms or see depression in our children?
I think the answer might surprise you because, it's not very common, and I'll talk a little bit more about that too. But we can see it as young as 3, 4, or 5,
Wow.
3 even. And you're going to see for these little guys, again, those somatic symptoms, the tummy aches, the sleep problems, the low energy. You could also see they seem like extra clingy, like they're always clinging on you. They have a problem being separated from you. So some separation anxiety. Another thing you might see is extreme shyness, and certainly behavior problems. Really is a very important indicator that they might be struggling with mood.
Yeah. Okay. Wow. This is such an important topic. My mama heart is like, okay, all my flags are up now, like watching for these things and listening out, because it's been just a crazy stressful year for all of us. We're going to get to that. So let's talk about how common is depression in children. You mentioned that.
Yeah, and Sierra, that's great that you're on the lookout for these things, because I think that's going to be another takeaway of our discussion, is that it really is important to be on the lookout for these signs and symptoms so that you have the ability to act. So depression, about 1 in 7 teens experience depression each year. So it's pretty common. An interesting thing to know is depression is about twice as common in teen girls as teen boys. But before that, before the teenage years,
I
it's,
believe that.
yeah,
As a previous teenage girl. Yeah, I can believe that.
Yeah, I feel that one. That one rings very true. Before the teenage years, though, it's equal between boys and girls. So then, it diverges a little bit more. In ages 3 to 5, you really get very little, few at least, that we know about. It's like less than 2% of the population. And then age 6 to 12, also, it's around 2%. And then you get more of the depression in ages 12 to 17 in children, about more than 6% of the population. So it's pretty common.
Wow. That's so interesting. I love that. I'm a data girl. I like the data. So I'm loving the statistics, because it just really puts a picture on it for me of just how, like you said, common that it is. And again, it's just something that we don't talk about. So I'm so glad we're talking about it tonight. Okay. What about, should we engage our children with conversation with this? Like, should we ask, are they feeling sad? Are they feeling depressed? And how can you tell the difference between just sadness or this could be depression? Maybe something we should check out.
Yes, absolutely. So experiencing some sadness is absolutely normal. You're right. Should we check it out, right? You're going to want to check it out if there are 3 things going on. So if your depression symptoms are persistent, severe, and they have a negative impact on functioning. So persistent would be like they're having symptoms, the symptoms that we talked about earlier, every day, most of the day. And if it's for like 2 weeks or more, that's something to take note of. And if those symptoms are severe, so more than ordinary ups and downs, they're intense, they get in the way for the child, they're disruptive to their lives, which leads to the functional impairment, the third piece. So if they're not doing the things that they normally do, like you notice, he doesn't want to watch his favorite show, he doesn't want to see his friend, she doesn't want to play with the toy that I know she loves to play with every day. It's getting in the way of school, friends, family, relationships, hobbies, any of those things. And then, yes, you should definitely talk to your child about that and ask if they're feeling sad or depressed. Because asking directly, we really want to, understand that part of the reason this is so hard to talk about is there's stigma around depression. And part of that stigma is because we don't talk about it, it's unknown, it's scary. So the more you talk about it, the more it can be helpful, and it won't be harmful. And I know that's something that can be a common myth, that if I bring up this depression or sadness, will that be harmful? Will that make them depressed? It won't. In fact, it'll be helpful. because you'll be letting them know that you're open to talking about how they feel. And that's really, really critical.
That's good to feel heard and understand, even if you can't understand, I guess not be understood because you can't always understand, but just to know a safe space to have those conversations that's good. And as a mom, that's a reminder, because I think sometimes it's like, just the question of, should I ask them or not ask them? I'm glad you're like, yes, like ask them and engage with them. Let's talk particularly about this last year. So we all know that COVID has taken a toll on all of us, but especially our kids. I mean, I caught myself a couple days ago, just in tears, grieving again about this wild year and how it's affected our family, from isolation, being at home, to not being with their friends. Birthday parties have looked different, everything, with their more screen time, let's be honest. Will this previous year of COVID and quarantine, is this going to permanently impact them, or are the effects going to kind of, wax and wane once school starts normally next year?
Yeah, Sierra, that's such an important question. And these are certainly such incredibly uncertain times right now. We've never experienced, I think, in our lifetimes, anything similar to this before. And the kids and the families are really feeling the severe impacts of COVID-19. And everybody's wondering these questions and thinking about how to help the children. And there are some things that you can do to help them through this time in terms of their mood. And one thing is that, yes, a few things even that I can share with you tonight. So you can help them by helping them to accept uncertainty. So these are very uncertain times. So helping them to accept uncertainty, and expressing your confidence as a parent that they can manage it and that you can manage it together. And something that can help you do that might be mindful practices, can be very helpful in terms of accepting uncertainty. And if you're worried that things are getting worse, is another thing. Make sure you take action to address it and heed off something more severe. So what you're asking is around, will we bounce back in terms of depression? Right. Will we recover the place that we're in? That's a good place in terms of mood. So if you're worried about things, part of what I really want to drive home to everybody that's listening is to take action. And if you feel that during this COVID year, things are just getting more serious, and you're noticing that your child's mood is suffering, take some action to head off a more serious depression. And in that way, you can help them bounce back if it's heading there. So you can do these things by staying active during this time, making new goals, right? So the world as we know it, is different now. So making new goals for the new reality. Also focusing on gratitude, having a gratitude practice with your family can all help. And also talking to them, again, coming back to that, talking to your child about how they feel and monitoring if they do need help. And then most important, getting them that help if it's needed so that they can bounce back.
That's good. That's good. On that note, in talking to our children, tell us more about that. Again, I have little people, so I feel like, especially my oldest, I get her talking and she won't stop talking. So no problem there. But maybe, when kids get a little bit older, they're less like, it's kind of awkward. Like, how do you engage that way, and talk to them about depression? How would you encourage a parent?
Yeah, I think that's a super important question, because how you talk to them is really critical. It's not just that you do talk to them. I think that's the first step.
Yeah,
is being open to talk to them. But then when you do talk to them and you're going to ask them about how they feel and about their mood, you want to have that discussion free of distractions, right? Just, not in the middle of, picking them up from school or something very distracting. No distractions. Neutral tone of voice is what you want to have, and staying calm. You can offer a bit about yourself first. So starting off, maybe they'll help ease into the conversation, depending how old they are, talk about your day first. Then you're going to ask them about their mood in a calm, objective, and most importantly, a non-judgmental way.
That's good.
So And part of the way that you do this is by asking them about things that are clear behaviors, right?
Okay.
You're going to be asking about things that you're seeing that they're doing that are different for them, that are clear behaviors in a non-judgmental way. So I can give you an example.
Okay.
So you could start off with, hey, Johnny, I noticed that you seem to be kind of eating a little bit less. Your appetite's not what it used to be. You're kind of more tired than I remember, and I see you're hanging out in your room a lot more. Is there anything going on? So you've given several behaviors, and then you've showed the child that you're concerned about them by asking, is anything going on? Right?
Yeah. And then leaving it open. I think so often we're like, are you okay? Is everything okay? Like yes or no, versus like, tell me what might be going on, to leave it open for them. That's so good.
Yeah, that's an excellent point. And I would just add to that it's different for different ages. Younger children might have a harder time telling you how they feel, or telling you, if you say what's going on, they might be tougher. So if they seem sad, just by asking them how they feel and showing your concern, you're showing them it's an important lesson that it's okay to talk about bad feelings. And if you have young children, it's important to start doing it now, so that they get used to that and they know that they can open up to you. I would check in early and often. You might also have to help them identify and label the feelings. Yeah. So, things like little feeling charts or emoji faces, to help them to say, which of these are you feeling, can be a help for little kids. How is your body feeling? Are you having a lot of stomach aches or headaches? And then if you look at the teenagers, they might hide their feelings, right? That might be a little bit of a different difficulty. So, they might hide their feelings to avoid being judged, to avoid that stigma. And I think it's easier if you're doing it early and often. But even if you haven't been, talk to them directly about their mood. If they seem sad or depressed, but don't lecture them, or they might push you away. And that could discourage sharing with you. And also finally, thank them for anything that they share with you, no matter what the age. That will encourage their continued comfort in talking to you.
That's great. That positive affirmation. Yeah. Sometimes we can forget that, we get in the conversation, but yeah, that's great because that keeps that door open for the future. I love that. Talk to us about, I want to take a minute. If you're just joining us, we welcome. We're so excited to have you tonight. We are speaking with Dr. Weinstein about depression in children. So a very important topic. We've got lots of great questions. If you have a specific question at any time, you can drop that in our Q&A box. We'll do our best to get to that. But moving right along, let's talk about at what point do we consult a physician about how our child may be feeling? Like, how do we know when it's time to get more help?
Yeah, Sierra, your physician is your go-to, your absolute go-to. So the answer to when to consult your physician would be like that's step one, always. Okay. And, part of the reason is, number one, you need to rule out medical concerns. Because when you think about that list of symptoms, it could be so many things.
That's right.
Number one, discuss any mood concerns that you have with your child of any age with your physician, as if they've been present for more than a couple of weeks. Your physician not only can help to guide you, but can examine the symptoms with you, but can also provide referrals for evaluations and treatment that you need access to.
That's great. That was going to be my next question was, how do we know if a child needs to see a therapist or a psychiatrist or a psychologist, or, there's lots of categories out there, but can you start, I guess, with your pediatrician and then they would refer you?
Absolutely. So talk to your pediatrician about the symptoms. And if, as we, if they're persistent and they're affecting functioning and they're intense, so those three things, you might even bring that to your physician, but also reaching out to a mental health worker in the community. You can do that as well.
That's great. That's great. Here is more of like a specific scenario. I just would love to get your feedback on this. But one mom is sharing that they're a military family, and so her husband leaves for weeks and months at a time. And so when her kids were younger, they didn't really seem to be impacted by his departures. But now her 7-year-old is, getting older, so she's feeling sad more often. And sometimes she'll just stop what she's doing and just burst into tears, because she's realizing that remembering her dad is away, and even it may be affecting her at school. Should this mom, like, how would you encourage her? Should she be worried that her child could be developing depression? Should she share this with her pediatrician? What would be her next steps?
Yeah, so thank you for sharing. I know we're all feeling an extra dose of pain and loss and missing people these days. So I feel for you and for your daughter in that situation. And if she's bursting out in tears, and that she's missing her dad a lot, I think a great place to start would be bringing those things to her. I noticed that you're saying you're missing dad, and I noticed that you're crying at different times, and pull in whatever other symptoms, behaviors that you notice that might be different for her. Or I notice you're not interested in doing the things you usually do. You're spending a lot of time in your room. Tell me what's going on. Is something bothering you? What's going on?
Yeah.
Start there and see what she says. I would go to your physician with that if it's been longer than 2 weeks, and you could consider, depending what comes of that, having a referral to a mental health person in the community.
That's great. That's great. Thank you. And thank you to our guests for just providing great questions, and thanks for engaging with us. Okay. Another question along this line is, one mom wants to know, is it more helpful for the therapist to be a pediatric specialist versus maybe an existing therapist that the family already uses?
Well, for therapy for depression is actually pretty specific in terms of children. And there is a few things that are what we call evidence-based.
Okay.
Right. And so these are therapies and medications that have evidence behind them. Right. And medications are more, we're talking about teens and more severe depression. But if you're looking for a mental health professional, you want to look for therapies that are evidence-based, including certain kinds of family interaction therapies. Cognitive behavioral therapy is really the most powerful one. And interpersonal therapy are really kind of the go-tos in terms of what you're looking for. So if your current therapist or mental health provider doesn't provide those things, and you've gotten a diagnosis of depression, I would seek someone who could provide those things. And again, your pediatrician might be a good resource to help you find someone that can do that.
That's great. That's great. Wow, such good information, and our questions are flowing in. We're definitely resonating with our audience. So a couple more here, and we're going to just keep going because there's so many good questions. What about autism, like in children on the autism spectrum? Is depression look different? Can it look different? Can you speak to that?
Sure. It's a very diverse population, I would say, and that I think it could look different for every child. So the answer I would give is that I would look for those 3 areas of depression really in any child, but that it might look different for each child. And again, if you're concerned for your specific child, your pediatrician would definitely be the place to start, and possibly from there an evaluation. So I don't know that there's any specific ways it would look different for a child on the spectrum.
Yeah. Okay, that's great. And jumping back to when we were talking about therapy, obviously therapy is very personal, and sometimes people just click with one and don't click with another. How do you know if a therapist is a good fit for your child?
Yeah. Well, again, if you've got somebody who's doing evidence-based treatment, the next most important thing is the relationship that the therapist can build with your child. And especially if they're doing something like individual therapy, it's very important that your child feel comfortable with that person, and that person is able to form a good relationship with your child. And I would say that they really need that as a therapist to work effectively with the child. So that's something you really want to see. Is it a good fit in terms of Is that therapist and my child able to build a good relationship to work together?
That's good. That's good. Along those lines, even as parents, I think those skills are so important. And you've spoken a little bit to this in terms of having a conversation with our children. But what other ways would you say of how we can encourage our child to be more open and honest about how they are feeling?
I think talking to them, again, very early and often about their mood and approaching them again in a very objective and non-judgmental way. There's things not to say. You don't want to say, just deal with it, or try and give them a lecture when they tell you what's wrong. So I think not trying to fix the problem as you're talking to them, I think would help to not discourage them, but showing that you're open, talking about how your day was, and the more you can talk about mood and depression, or mood, happiness, and how they feel, the more open they're going to be with you. And then again, to show your appreciation when they do talk to you. So thank you for sharing your feelings, and keeping calm, keeping neutral, and keeping that non-judgmental approach.
That's great. That's great. So we know depression and mood, there's that link there. Talk to us about what a child's mood would look like if they are depressed. Like, is every child just, moping? Maybe not necessarily. What would a mood look like if they are in fact depressed?
So again, it would be a little bit different in young children as in older children. So really with those young children, I know, Sierra, you have young children, and as many folks listening may, I think the surprising thing for young children is that you can see behavior problems. Yeah. So behavior problems are the number one reason that parents of young children seek mental health support. And a good many of those children may be struggling with some mood. So I think irritability is a surprising one. Behavior problems, aggression, those kind of things can indicate mood problems in younger children, as can extreme shyness, clinginess, being afraid to go somewhere without you, not wanting to do the things they normally do, I think goes for all ages.
Right.
Making decisions.
That's good. Yeah, I know I have always thought like, oh, well, if it's depression, then everyone's going to be sad and mopey, but because you kind of think of those irritability or acting out behaviors as very, on sort of behaviors, and kind of think, oh, it's just off. But I'm just loving that you're drawing attention to that, because sometimes we can overlook that and miss the heart of the matter, for the outward behavioral issues. So I appreciate you giving us some clarity on that. Okay, what behaviors might we see? We're talking about behaviors. What might we see in a child who is struggling with a depressed mood? I know you said irritability, but kind of how would that manifest?
If your child, goes to school, comes home, doesn't, go out with their friends like they usually do, doesn't, engage in the activities they normally do. Let's say, they don't eat a lot at dinner. They seem very tired. They're, yawning all the time. They're walking around slowly, complaining a lot, either about, how they feel, what's going on in the house. They feel more guilty than you think they should, saying things like, why should I bother? These kinds of things, or maybe they go right up to their room and they stay there. So you might see some withdrawal. There, I think, is a sign.
Oh, great. Good indicators. And I'll just say for the mamas out there, we got that little mama instinct sometimes. And I think sometimes we even can just sense, when our children are off, like something is not right. And so just a great reminder. And Dr. Weinstein, you've been saying, get with your pediatrician, talk with your healthcare provider. That's why they're there. They're a resource for us. So, and these webinars are just amazing because we're really able to dive into these topics in, greater detail. So let's talk about, I could take a couple audience questions. One being, help us understand the difference between maybe depression and anxiety. I hear the two together a lot. And so how would you maybe differentiate between those? Are the symptoms similar or different?
Yeah, I think, again, there's a lot of kinds of anxiety, and I do think that they co-occur quite a lot. Depression is more around, mood and functioning, and anxiety is also around functioning, but I think in a different way. So anxiety might look closer to avoidance. So if it's an anxiety around, social things, the child might avoid going to parties, might avoid, might not have many friends, or might not feel that they can be good at making friends, or if the anxiety is around other things like taking tests or something like that, I think that would appear very different. So, or maybe around school. So, but I think there are symptoms that could overlap. So for example, if the child has anxiety around things that are happening at school, they might not want to go to school. But that might look similar to depression, where they might not feel like going to school, or they might not be motivated to go to school. And a common symptom there might look like academic problems, where you could see that in either situation. So I do think that it's sometimes hard to tease these apart. And in addition, both may be going on. And so you may consider an evaluation to kind of help you sort it apart, so that you can figure out the treatment that's going to work best.
That's great. That's great. Thank you. That's good advice there. So let's talk about, you mentioned treatments. Are there effective treatments available for childhood depression at a very young age, or are medications the only option? Talk to us about treatment options.
Yeah, so medications are actually not used very often for younger kids with depression, unless it's very, very severe, because the side effects, it's not as shown as effective, and the side effects are kind of worse. So for younger kids, we're looking at family interaction type therapies that are focused on the family, and it's focused on interactions between family members that affect mood. So this would be like a program that would coach parents to help them praise what's positive about their child. And also help the parents reduce like their focus on what's negative, right? So teaching parents on how to interact with their child in a more positive way, helping them provide consistent daily positive attention that can increase child self-esteem, security, and reduce depression symptoms.
That's good. That's good. We have an audience question too, along the lines of, how do you best help your child when they show their depression with that irritability and anger? What would be, I guess, maybe some coping mechanisms or way to serve our children in that?
Well, depending on how old they are. So if it's a very young child and they're showing, irritability or aggression or something like that, you might consider a program like parent training, something like parent-child interaction therapy can really help with that. And, in terms of teaching families these skills to help that child. Also, I would say if it's an older child, you do want to figure out if there's other symptoms around that, if it might indicate depression or not. But I would say, using empathy with that child rather than reacting and getting angry if they seem irritable, trying to understand, and again, having that talk with them around, I noticed you seem irritable. I noticed, you haven't been coming to our dinner table, or I noticed you've been disappearing into your room a lot. What's going on? Again, that non-judgmental, and see what they say, rather than going to them and saying, what's wrong? You've been, it's been, not great for us that you haven't been around, or whatever, avoiding the criticism, I guess, is what I'm trying to say around that. And using more of your empathy and understanding is really going to help that child.
That's good. That's good. Empathy. Oh, so important. Yeah. We all want to receive it, but sometimes it's hard to give it, it's a good reminder. Okay. What about, is depression a lifelong disease, or can you grow out of it? Can you come out of it? Or is it something you always are going to, if you are diagnosed, you're going to always deal with it?
Yeah. So that's a interesting question, because the truth is, you can't rely on kids growing out of depression if they really have, a depression that's different than just normal everyday sadness because untreated depression has quite a high relapse rate. So there's a greater chance that if your child has depression and it goes untreated, that they'll end up getting depression when they're an adult. However, with treatment, that relapse rate goes right down. So that's important to know. And even though there's a variety of causes, there's still many things that you can do to help that.
Yeah, that's great. A good reminder that there's so many resources and tools available, and it's not something we want to just kind of brush off and think, yeah, they'll grow out of this, or I'll grow out of this, or if you mamas or daddies listening may also be listening to this going, well, maybe I need to seek some medical attention. It's always great to add those tools to our tool belt. What about if a child seems like they might be depressed, and you've touched a little bit on this, but like, what should the parent do? What are the next steps?
Yeah. So yeah, of course, going for that medical checkup and getting guidance from your pediatrician. Next step, or could even be the first step, would be talking to a mental health professional, even if it's one that you are seeing already. Talk to them about what's going on. If you have somebody and you can get direction from that person, either to I would move to maybe an evaluation to find out what's really going on. Look for reliable resources like to learn more about depression, and we'll provide some online resources and things like that, like the American Academy of Child and Adolescent Psychiatry, things like that. So I would learn more. I would give the child as much emotional support as you can. So this would look like spending time with them, but without being, I know these are really hard things to do, without, trying to get them to talk to you or trying to be pushy in any way. Can help just to spend time with them and do things with them. Practice listening without the judgment. For example, if they tell you they feel tired, so even though they got enough sleep, don't argue with them by asking, tired, I know you got plenty of sleep. You can use encouragement and supportive statements instead. So they got enough sleep, they say, I'm so tired. You say, sounds like you don't have much energy today. Supportive statements like that, acknowledging and validating their feelings. Then they'll be more comfortable to talk to you. And if they feel sad all the time, and instead of giving them advice, you could say something like, I'm sorry you feel sad a lot. That must be very hard for you.
That's good. Yeah, that active listening to show that you heard what they said. And sometimes it's as simple as, I remember my undergrad, I did child development and some psychology in my undergrad, and I remember this concept of active listening, because believe it or not, I'm a really good talker, not the best listener. So I use these skills. I try to remember that, but that literally active listening is just telling them back what they said, even to help people feel heard and validated. And these are skills that we should be practicing regardless of how our children, whether or not we feel like they may be, struggling with depression. So this is great, Dr. Weinstein. Thank you. What about, on that note, if a child is struggling with sadness but doesn't want to get help, and maybe this is an older child, where they're not wanting to get any help?
Yeah, so maybe you're talking about a teen or a little bit older child that would actually express something like that. And so the things that they might not realize, that how they're feeling or how they're acting is related to something like depression. But guess what? That's part of the depression, right? That's your depression talking. So also, there might be a worry there for someone the age of a teen, that they might be struggling, but they might worry very much, like, what are other people going to think? It's that age where I think that that's a lot more intense, but also the stigma around, how you're feeling, or if you're depressed. So I would say you want to persuade them gently but firmly, that they really do need to get help, and talk openly and honestly. Again, it's going to grow out of these discussions that you start with them around things that you notice that are different. You're talking openly, honestly, about what changes you see and the signs of the mood concerns that you have and you're observing. You want to use that empathy with them. For example, you could say, I noticed you seemed really sad. You've said that you felt sad. It must be really hard for you to go through your days, with that feeling of sadness. And what that can do is possibly alleviate the fear of what you'll think for that teen, because you're already expressing empathy, can alleviate fear, can alleviate some of the shame that they might feel and the stigma they might feel about having concerned about mood and depression. You can also talk about how untreated depression can get worse. So if we don't, if we do something to manage sadness, it can improve, and if not, it can get worse, and it does potentially have negative impacts later. You can make a deal with them too. Like if you'll just go for an evaluation, you can you can borrow my car X, Y, or Z night, or whatever it is that your kid really wants to do. Give them a reward for going for evaluation. It is worth it. It is worth it. Provide support too, to let them know that you are going to do whatever they need, for as long as they need you to do it. You're going to be there, and that you really want to help.
Yeah, great. So important, such an important topic. Like you said, it's not something we should just gloss over or say they grow out of it, but really important to give it attention. You spoke to this earlier. I'm receiving some audience questions, but I know you talked about, depression can be biological, it can be genetic, it can be, psychosocial as well. One question we received was if a maternal or a paternal family member who had depression during pregnancy but took medicines, although they have a family history of depression, anxiety, is the child less likely or more likely to be depressed or struggle with depression in their lifetime? Is there evidence-based research for this?
So the question is if the medicines that the pregnant mother took would help the child?
Well, if like you mentioned, the biological and genetic things that could make it more susceptible for a child. But what if the parent took medications? Does that erase those biological and I think I kind of know the answer, but just want to know from you, would that erase it? This mom wants to know.
Yeah, thank you. I think I understand. So I don't think it would from the question, because those genetic and biological pieces are really not are separate from the medication, and that that medication might help the person taking it in the moment, but when they stop it also, medication wouldn't help anymore. So it wouldn't have any effect on improving the mood or changing the risk. I think that's the question. Changing the odds that child would experience depression in their lifetime would more be based on those other things, the biological factors, the genetic factors, and the psychosocial factors together.
Yeah, so great. Thank you for the clarity there. Another attendee is asking, how do you deal with mood changes in girls during that monthly cycle? Obviously, that may not be depression, but we're seeing that fluctuation in mood. Would you have a similar approach to what you've been saying of those who are struggling with depression?
Yeah, that's a great question. And yeah, I totally can empathize with what it might be like to parent a teen girl going through those things. And I think you would use some of the very same things. So approaching, to let that child know it's okay to talk about how you're feeling. I noticed that, you're whatever it is that they do, you're withdrawing to your room. You seem sad, you were crying, you got angry. What's going on? And what, maybe offering what you can do to make her more comfortable. But just being empathic, going with a non-judgmental, open, and a neutral stance to just check it out and see, like, is this something bigger than what it looks like monthly? Right. And if not, is there something I can do to help? I think would go a long way to start a conversation just about that it's okay to talk about how you feel, which would be generally a helpful thing.
So helpful. You know what else is helpful? Chocolate. I'm just going to say that personally. I don't know. Maybe try it, Mom. So I'm teasing. A chocolate and a little talk, chocolate ice cream and go talk about it. I'm teasing. Okay. Talk to us about can test anxiety in children, say like 7, 8, 9, 10 years old. Can that present itself with symptoms like a headache? Could that be a test anxiety, or could that be something like more depression? But I know you mentioned headaches earlier. That was one of our questions we received.
Yeah, so I think that question certainly comes out of me talking about headaches here for sure. So headaches can present as a somatic symptom of, one of the somatic symptoms around depression, more in younger children or even older children. In terms of anxiety, I guess I'm not sure, although it sure sounds like a handy way to get out of a test if you said you had a headache. But beyond that, in terms of anxiety, I'm not sure, but definitely for if the child is having a lot of headaches, I think it would need to be more than one headache, that you might look at that as a symptom of something larger.
Right. Okay, great. So many good questions coming in. I hope we can get to all of them. Talk to us about, I have one attendee who wrote and said that they're a nanny caring for a 5-year-old girl and a 3-year-old boy. She's helping them keep up with their home learning and their activities. And first of all, I just want to commend this woman because you are here, you are learning resources that can help you and serve this family. So awesome. Great job for that. But she wants to know, how can she help navigate these children through the challenging times and help them understand things are going to be better? She said, one of the children is talking specifically a lot about the virus, how she feels sad about not being at school. So any tips or advice for her?
Yeah, and I do want to echo your sentiment to all the parents on here who are coming here, in the night after a long day of taking care of your families and coming for this extra information. So I commend you all.
Right.
Yeah, so again, it's about helping children through this year, I think is a big theme and something that we really can do a lot about. And so helping, I think you said the ages were 3 and 5.
Mm-hmm.
Certainly helping kids that age, or really any age, through this time and promoting their mental health would really be around things like healthy diet, getting enough sleep, getting exercise, staying active, forging positive connections, right? It sounds like they certainly have a very positive connection with you, given the love and care that you're putting out there and extra effort to do that. So positive connections with you, with the family, with people at home and school. Limiting screen time can really help. And I know that the temptation and the reality is that we just have a lot more of that. We even have that as we speak, but limiting screen times with the little ones, encouraging physical activities, encouraging fun time with friends. Also, like even with children those ages, they're not too young to have a gratitude practice. Mm-hmm. And that's something that I think can help anybody through these times.
That's great. Oh, that's so good. And we are so well aware that we all come with specific situations, and all this information is so helpful. There's so many great nuggets that we can take away. I wish we had time to go just one-on-one on every situation, but I do have a mom who's asking about her child is currently doing cognitive behavioral therapy. They're doing that in their home. It seems, I think from the question, I'm discerning that maybe that he is struggling with some anxiety-based behaviors like nail biting and teeth grinding. Do you have any recommendations for her?
Well, I think that's wonderful that you've gotten an evidence-based treatment lined up for your child. And it sounds like you're doing it at home. You're able to do that through telehealth. And I think you're there. I think you're on the exact right thing to do. Again, any of the recommendations that we just talked about. So around promotion of health, so healthy diet, sleep and exercise, positive connections, making sure in addition to the wonderful things that you're already doing for your child, making sure those things are there. I didn't hear how old the child was. But another thing I want to add to this, especially for young children, but really for all children, is positive one-on-one time with the parent. And Again, they're, a time where you spend with them, just the two of you, where you're providing positive attention, playing with them. If they're young, letting them, pick the toy and be the leader of the play, and learning how to do those things. And I think that can really help in terms of making a child feel secure and calm.
That's great. Wow, I'm looking at our time and I feel like we've been doing this for 10 minutes, but we are nearly almost a full hour in. This conversation has been so helpful. We're going to take a few more questions and then we're going to wrap it up here. But let's talk about quickly, how can we promote mental health for our young children and for our teens?
Yeah, and I think that the recommendations are really quite parallel, just in terms of health, limiting screen time. I know it gets so much harder with those teens. And I think, during these times, really trying to stay active, using tools like meditation, using tools like, practicing gratitude with your child, making sure that they have positive connections, not only with you, but if you can, within the community, I think are really important. And also checking in with them in the ways that we've talked about during this hour, checking in on how they're feeling and not letting things go, right? If you're seeing something that concerns you, make sure to talk to your child about it, in that calm and non-judgmental way. And if you're feeling concerned about them, get some help. And I think that's really what's the most important thing to get through.
Oh, thank you. That's so good. I want to wrap up with two more questions. One you a little bit addressed, but we talked about children with special needs and how can we understand if depression may be a factor when some of the symptomatic behaviors are part of their, normal behaviors.
Yeah, that's such a good question, and a hard question too, I think, in part because I do think, for individual children, things might look very different. And it's certainly very hard to tease apart symptoms from things that are just specific or particular to the child. So that's a really hard question. And I think I would lean on the answer of talking to your providers and talking to your pediatrician and talking to other providers and just not trying to go it alone. And, as a parent, just really reaching out to that community that I hope that we have around us in Miami. And I hope in all of the other places where you're listening.
Yeah, that's great. Thank you. And just one final question, and I'd love for you to, share any resources that you have. You have some amazing resources to share with all of us. But one question we did receive, we talked about symptoms that could be, signs of depression, but self-harm. So I had one attendee asking, is self-harm in a 9-year-old, is that a sign of depression? And what would you tell this mom?
Yeah, that can be a sign of depression. That can go along with mood concerns. That can go along with a child's ability or struggle with regulating their mood, and maybe doing those kind of things to help them cope and to help them regulate their mood. And I think in particular, that's one you should definitely reach out about. And I think, that's very important, that if you see that symptom, that you definitely want to talk to your teen about it and you want to get some help for that.
Yeah. Great. We could go on and on because there's just so much here. This topic is so important. I think we need to do another round of like maternal mental health. As a mom myself, I'm like, all this, I need to ask the same questions for myself. But Dr. Weinstein, thank you so much for joining us tonight. We're going to wrap our time up here. So thank you to everyone who has joined us. I do want to draw your attention quickly here to these lists of resources. So you could take and screenshot this or pull up your iPhone and take a picture. Some amazing resources here. Dr. Weinstein, would you want to mention anything about any of them specifically?
Let me see the ones that you have here. Yeah, so some great websites on there. So the ADA has fantastic information, and NAMI is really wonderful. The Florida one is listed there. They have so many resources. And if you have any, more severe concerns, certainly the first one there, the Suicide Prevention Lifeline, never hesitate to call that to get information and help when you feel you need it. Jackson Mental and Behavioral Health should be your go-to for mental health concerns. So calling them to talk to them about possible resources that they have there. Another resource I could share with you are the Parent Club workshops. If you're interested in learning how to use positive attention with your young children, these are free workshops that are online that you can go to and learn how to do those things. So that's a wonderful resource that's available to everybody.
That's great. And I do want to tell you, those that are listening in, if you registered for tonight, you are going to get an email with all of these resources and more. So watch your inbox for that. And again, if this was helpful for you tonight, you want to share it with someone or you want to go back and reference, it'll be available for a rewatch on jacksonevents.org. So at any time you can go back and watch previous ones. Give us about a week, we'll get that up there. But I do want to draw your attention to 2 weeks from today. So we've been doing these about every 2 weeks. So 2 weeks on May, I believe it's May 6th, we're going to do the Parental Guidance episode on sex education. So it's the one I'm like, we'll probably have the biggest crowd. Whenever we talk about sex, everybody shows up, right? But such an important topic with our children. When do we start talking to them? How do we talk to them? How do we bring this up? What's appropriate? All of the developmental things. It's going to be a really great episode. So please make plans to join us in 2 weeks on May 6th, Thursday. You'll see on social media, follow, Jackson Health, follow Expert Kids Care, follow Miami Mom Collective, and we'll keep you up to date with all the details of how you can sign up. But again, Dr. Weinstein, thank you so much for being with us tonight. And everyone who joined us, we appreciate your engagement and just around this important topic. So thank you, and watch your inbox for some information with all of those resources to serve you. So thank you again for joining us, and hope everyone has a wonderful night and a great week.